Hey, it's Dr. Christopher Lauria, DC from Roanoke Knee Solutions. Tonight, we're signing on for our second live stream Facebook Live event to continue to educate the community on some of the symptoms they're having and what can be done to help them. Trying to pick some topics from current patients that are in our office, things they complain of, things that they want answers to. So we're just going to give everybody a couple of minutes here, or not a couple of minutes, but about 30 seconds or so, just to get signed up and get set up, so we can go over this brief discussion that I have set up for you this evening. Appears that there's a couple of people coming on, so that's good. Very good. I think that's good. I think some people will spill in here as we go along. The topic I want to cover tonight regards the knee. We do have specialized programs for knee pain, and one common complaint that I get from patients, excuse me, that come into the office is that my knee or knees kill me when I'm going up and down steps and stairs. Why is it so bad? I have to avoid them. I have patients that have to go sideways, patients that go up one step at a time, patients that actually, although it's dangerous, have to go up backwards if they're in a split level house or a house that they have to go up and down stairs. I also hear a lot of complaints about this when you're doing or going up and down hills and those type of things. So people avoid those when they're walking and those type of things. Well, in order to understand that, you got to understand the knee itself. And this is a model of a knee. You just get this straight here. You're looking at a knee from the front. This is the femur bone, the upper leg bone. You got your shin bone, your tibia here, and then you got the knee joint that makes up. You've got an inside and outside joint space, but most of the problem that we're talking about going up and down the steps and stairs involves your kneecap, which is called your patella, and it's in the front of the knee, and there's actually a joint behind your kneecap. And you see these big gold things here or tendons that allow the kneecap to glide up and down. And we're in a resting position, the kneecap just sits there. But when we stand up, the kneecap glides up and down. When we're walking, it somewhat glides up and down. When we're going up and down steps and stairs, the kneecap really glides up and down a lot. Same thing with hills. So if there's a problem with the joint behind the kneecap, it'll cause severe pain with people. Um, if there's inflammation, irritation in the joint space when that kneecap glides up and down, it's obviously going to cause pain. The more it glides up and down, the more severe that pain is going to be. The other thing that happens when a kneecap isn't, the joint space isn't functioning right, there'll be arthritic spurs that will form around the kneecap. Again, when that kneecap is gliding up and down, steps, stairs, walking, hills, climbing hills, and things like that, those arthritic spurs will cause more inflammation and irritation too. So that's my answer to people. There are obviously some other things that are not as usual as this that will cause pain while coming up and down stairs, but that's probably why you're suffering with that type of thing. There's inflammation, irritation underneath the kneecap in that joint space due to degeneration, due to trauma, due to wear and tear, and those type of things. So what do we do for that? We have a laser treatment, a class 4 laser therapy, which drives energy into the joint space there, and it causes a reaction in the body in that joint space that'll help to cut down on inflammation, irritation, swelling, pain, those type of things. It'll allow better function of the kneecap. We also do different types of therapies, exercises to get that kneecap aligned better, functioning better, and those type of things. So that's a non-surgical way to help that pain while you're going up and down stairs. It's what we do in our office. There are patients who try cortisone shots that are designed to cut down on the inflammation, irritation, swelling, pain. There's physical therapy can help strengthen the area also. Ultimately, if that kneecap is bone on bone, there's no joint space at all. Those are the people that chances are that they have to get a knee replacement. Now, there's people who need knee replacements due to that. Um, and for some reason or another, they can't get a knee replacement. Their body mass index is too high. They've got heart conditions, other organic conditions which can prevent them from getting knee surgery. Laser provides a very safe alternative. There are no side effects. You're stimulating a body's natural reaction to cut down on the inflammation, irritation, swelling, pain. There's tons of research on the effectiveness. The good thing about laser, too, is if it helps you, if that reaction starts to happen and the pain starts to go away, it is a longer lasting treatment. So they're doing follow-up studies on people that are at a decreased pain level for 2 to 3 years after they get their treatment. So that's the cause of the knee pain while you're going up and down stairs. And it's something that can be helped with some of the different therapies that we do in our office. So if you're suffering with pain, in your knee or knees going up and down stairs, it's really affecting your life. You can call our office at 540-210-1445. It's Roanoke Knee Solutions, and you can set up a consultation. And I'll go through all the testing. I'll review your X-rays to determine if the laser is going to be effective in your case. Like I said, it can't help everybody. Depending on the severity of the joint, how much arthritic spurring there can affect whether the laser can help you or not, number one, and number two, whether a laser can help you at all. So again, if you're interested in doing that, I'm Dr. Christopher Lauria, DC, from Roanoke Knee Solutions. You can call our office if you'd like to speak to me about your case. We do phone consultations too, but it'd be a chance to see if you can get relief with some of the things you're dealing with. So until next week, we'll get another question or something from a patient. If you have a question, something you'd like me to talk about on this next live, you can call the office and just give us that information. The email is info@roanokediscenter.com. You can send me an email, message me on Facebook, or respond with a comment to this live tonight with something you want to hear on our next live. Okay. Hope to see you soon. Hope this helps you. Thanks.